AA, Smart Recovery. What's the difference? In the world of community resources, for people in recovery from addiction, people often ask, how are 12-step programs distinct from Smart Recovery? This video is dedicated to uncovering the answer. In the vast, intricate universe of recovery, there are countless resources available to those who seek help. Among these numerous options are the traditional 12-step programs and the more contemporary Smart Recovery approach. The 12-step program dates back to the 1930s, sprung from the economic hardships of the Great Depression by pioneers Bill Wilson and Dr. Bob Smith. Both men, in their own pursuit of sobriety, conceived the original 12-step program, Alcoholics Anonymous. Alcoholics Anonymous was designed to serve as a haven for alcoholics, a safe space to express their struggles and lend mutual support towards a collective goal, recovery. The program proposed a sequence of guiding principles called the 12 Steps for addicts to break free from the shackles of their dependency. These principles highlighted the need for reliance on a higher power, a concept flexible enough to accommodate both religious and non-religious interpretations. A crucial part of the program involved acknowledging one's lack of control over their addiction. Even one drink would lead to the desire for more until the person was wholly intoxicated. The 12-step program employs a sponsorship model for support, utilizing personal experiences of those who have achieved abstinence. The 12-step program currently continues to maintain a significant global footprint, with Alcoholics Anonymous boasting a membership exceeding 2 million individuals. The program promotes sobriety first, that is, steps 1 through 3, then encourages the removing of resentments, both past and present, to make sobriety possible to sustain. These are steps 4 to 9. Finally, steps 10 to 12 encourage a spiritual program to maintain sobriety in the long term. The 12-step program's influence on addiction treatment strategies is substantial, with its principles incorporated into various treatment programs. Local examples include Renascent and Bellwoods in Toronto and Homewood, Ontario. Smart Recovery came into existence in 1994 as an alternative to the traditional recovery programs, originating from the principles of rational recovery. The pioneering group, Smart Recovery, or Self-Management and Recovery Training, has as its mission to foster a self-empowering path to overcoming addiction. They envisioned a recovery model that would invoke personal strength, instilling hope in individuals battling addiction. Over the span of just over 2 decades, Smart Recovery evolved from being a small initiative with a handful of scattered meetings to becoming a worldwide community, bringing together a monumental number of individuals united in their fight against addiction. The growth and scalability of Smart Recovery, upwards of over 600% growth in the last 20 years, is testament to its efficacy and appeal to those seeking a different approach to addiction recovery. The most striking feature that sets Smart Recovery apart from the traditional 12-step programs is its individuals to tap into their internal reservoir of strength to overcome addiction, allowing individuals to set personal goals which may include moderation as opposed to complete abstinence. At its core, Smart Recovery leverages cognitive behavioral techniques to empower individuals to manage cravings and lead balanced lives. Let's look at some of SMART tools in more detail. First, we have the ABC model. It represents activating events, beliefs, and consequences, and it's used to identify triggers, understand beliefs, and recognize consequences of addiction. Next, the urge tool. It provides insights into managing urges with strategies for handling them, like distraction, relaxation, or patience. Lastly, the disarm model. It stands for Destructive Imagery and Self-Talk Awareness and Refusal Method. It aids in identifying and rejecting self-destructive thoughts and behaviors. So what are key differences between the 12-step program and rational recovery? Let's find out in our next segment. While both programs aim for the same end goal of recovery, their approaches are distinguishably different. The 12-step program, recognized worldwide, necessitates its participants to come to terms with their inability to control their addiction. It encourages them to see the recovery process as an act of surrender and a quest for help from a power superior to themselves. This means the first and end goal of the program is abstinence from drinking. The program utilizes the method of the group, believing that this encourages the addicts to accept and overcome their shame and resentments. On the other hand, Smart Recovery offers a different route to recovery with a strong focus on individual empowerment. It allows individuals to set their own recovery goals, which may include moderation or complete abstinence. It places a strong emphasis on self-responsibility and self-directed change, with a belief that recovery is possible through the power of choice and determination. Like in AA, the SMART program is built on group work, but its leadership is created the cognitive behavioral techniques to ensure the group achieves its tasks in an orderly fashion. While the 12-step program promotes lifelong participation, viewing recovery as an eternal journey, Smart Recovery typically lasts months to a year, depending on the individual's progress. Thus, while both programs aim for recovery, their paths to achieve it are distinctly different. In the battle against addiction, both 12-step and Smart Recovery hold merit. One study about AA showed that members who attended at least one meeting a week had an 80% chance of achieving sobriety even after 10 years. Unfortunately, research about the success of 12 steps is difficult due to the anonymous nature of the participants. The Cochrane Review of Alcoholics Anonymous is one excellent study that has been successful, and it confirms that AA is as good as, and sometimes even better than, alternative treatments. Smart Recovery, a secular approach, has shown similar effectiveness in substance use reduction, especially in the short term. One study found that participants increased their sober days by 72% while in their program. Remember, both programs seek to gain more than just abstinence, but improved life quality. This has been shown for both programs. So, must we choose one program over the other, or can we use both, utilizing the unique qualities of each program to complement the other? We believe that they can be used together. Learning the cognitive behavioral tools, for example, dovetails nicely with steps 4 and 5, which require cognitive reassessment and reframing of ideas. Since both programs offer the common goal of abstinence and a vibrant life in sobriety afterwards, and both promote fellowship among like-minded individuals, you can't really go wrong. You decide what is best for you. Thank you for watching, and please check out our other videos on addiction and addiction recovery on this YouTube channel.